Morning friends, we are demonstrating the Perform Tornier set. It is one of the best set for the reverse shoulder and it is based on an inlay system. So what it does, it reduces the tension and it minimizes the tensioning and it's more of an inlay sort of a stem, so you can medialize the humerus. So what is important here is understanding the system. This system has been in market for years and is known for its good performance. So let's see the system. So it's a very easy system to do. This is the set which is available in India at present. And if you appreciate, we'll start from the glenoid. So if you see, the glenoid system comes with two sizes. You have a base plate of 25 millimeters and you have a base plate of 29 millimeters. And this you can insert either at a 0-degree angle, which is seen here, or a 10-degree angle, which is seen here. So if you are using a 10-degree angulation, the superior one is marked here. So you have to mark superior, put the jig like this, and then it will drill around 10 degrees inferior angulation. So this is an inferior 10-degree angulation. If you want to achieve this, drill will help you with that. So you can put it either in 0-degree angulation or you can put it in 10 degrees of angulation. This is the first step. So once you are through with the central wire, you have half moon reamers. Now this reamer is for 25 and reamer is for 29. So you have to ream the surface of the glenoid with these reamers. These are half moon reamers and these are useful while entering. So because you have a posterior retractor, so these half moon reamers will help you to go in easily. Once you are done with the half moon reamers, you need to ream the central boss reamer. So this is the central boss reamer. This is a central reamer and this is basically we drill it over the cannula itself. And once you ream this boss reamer, then you have an option of 3 central fixation. You can use either a 6.5 millimeters screw, you can use a 9.5 millimeter screw, and you can use a mega boss. So you can use a large post which is 15 millimeters in length. So this is a standard post and you can use a longer post which is available. Can you show me the longer post, please? So there is a reamer which is there for the longer post. So if you want to use that, you can use a longer post. So normally in all my regular cases, I would use a 6.5 millimeter screw. In those scenario in which you don't get a good fixation with 6.5 millimeter screw, you use the 9.5 millimeter screw. If you want to use a tap, that tap is available. And then you have the depth gauges which are available. And this actually device will hold the base plate into its position. Now this is the reamer for the mega post. So this is a post, this is a longer post. So in reveal scenario, when you don't have an adequate good central purchase, you can use this reamer and use a large post centrally to fit it. So 6.5, 9.5 and large post, these are 3 options. So it can be used for a standard as well as revision scenarios. So once you are through with that, you have an option of putting screws. On the superior and inferior side, you have a screw which is locking in a variable angle. And on the anterior and posterior side, you have simple compression screws. At least 2 screws are mandatory. And if you are using a lateralizing option, it is recommended that you use a screw which is more than 26 millimeter in size to have a very good purchase. Because if you are lateralizing your base plate or you are lateralizing your glenosphere, it is better that you have a very good purchase on the glenoid because there are a lot of wear and tear forces there. So superior inferior minimum 26 mm screw is important. This is a locking variable angle screw which is there. Can you show me the variable angle sleeve? So the variable angle sleeve is available. So this is the variable angle sleeve which is there. So this sleeve, you can see, you can tilt it little bit in the direction and then this 5.5 millimeter screw will go into the direction. Now important point is the screw will be impacted into the base plate, but technically the screw is free into the base plate. So you start whenever the back table will give you a screw base plate construct together, and you start screwing, and when you screw in the end, you will feel that there is a compression in the end because the screw is not locked into the base plate. The screw will slide, and in the last few turns of the screw, the base plate will compress well against the glenoid. So that will give you a very nice glenoid set. Now this set gives you an option of lateralizing the base plate. It gives you the option of lateralizing the glenosphere. So if you see the glenosphere, there are 4 varieties of the glenosphere which is available: 33, 36, 39 and 42. The 36 and 39 and 42 are available in 2 other options. So you have a standard glenosphere, then you have a lateralized glenosphere if you want to lateralize, and then you have an eccentric glenosphere if you want to inferiorize. So this is the superior marking. If you see, this is the superior marking, and this will, you can actually do an inferior placement of the glenosphere. So this is one important thing. The good part about this system is the glenosphere is locked into the base plate with a small screw. So there is a very less chances of disengagement. So supposedly if you want to lateralize, you can use this lateralized glenosphere. Apart from that, the lateralization option is also available. So if you see the lateralized base plate, you can see that it is more thicker, glenosphere, it is more thicker than the standard glenosphere. So in the system which are classically based on the inlay platform, it is recommended that you lateralize, because if you lateralize, you will get a better range of motion and you will get a better function. Because increasing the lever arm is important. So that is very important here. So if you are using an inlay system, my preference is to use a lateralized glenosphere, but you can use a standard one. And if you want to inferiorly shift your glenosphere, you can do it here. So you have an option of a lateralized base plate and a lateralized glenosphere. So this covers the part of our glenoid. Now, as far as the stem is concerned, the Tornier gives you an option of sizes 1 to 4. And if you can see here, these are the 1 to 4 sizes of the stem which are available. Now these stems are also available in plus size, long size and extra long size. So a large pattern of the stem size is available. But the important thing here is the stem preparation. So the most important thing is to prepare the stem properly, and for the stem there are 2 kinds of fits that you get. One is a metaphyseal fit, which is the base of the inlay system, and then the stem. So the first thing that you need to take care is you need to size the humeral cut, and you have a size 1, size 2, size 3 and size 4 protection plates that you can use to protect your cut. Once you are done with the cut, you need to place the recommended 1, 2, 3 or 4 size base plate right onto the cut. If your cut is little superior, it is recommended that you place this device little superiorly, and if you cut a larger cut, then you can place it little inferiorly. Once you are done with that, the position with that, you put a wire inside, and this wire should be passing out through the lateral cortex, and over that we would ream with the reamers which are given. So these are the reamers that are given, and these reamers are used to ream the metaphyseal area. Once you are done with the metaphyseal reaming, you need to ream the central part of the diaphysis. So once you are done with the metaphyseal reaming, like this is the number 3 metaphyseal reaming, after that you will use the diaphyseal reaming with this. So you put this into the metaphyseal area, and then this slot will be used for the diaphyseal reaming. So if you are using one, use one diaphysis. If you are using 2, use 2 diaphysis. So this is how, after putting your stem like this diaphysis will go, and this will give you a good purchase. So there are 2 preparation, metaphyseal preparation as well as the diaphyseal preparation. Once you are with the preparation, you are done with the preparation, this is the impactor. Now this impactor is important because you have to impact both for the metaphyseal and for the diaphyseal. So whenever you are implanting the implant, you need to implant both on the metaphyseal and the diaphyseal side one by one, so as the implant will fit both on the diaphysis as well as metaphysis. Now as far as the cut is concerned, Here the cut is very important, and this is the cut that we make. So this cut is a 135-degree angle cut. So you put it into the diaphysis. The cut is placed right side, you pin it accordingly. After that you take out the wire and then you place the cut just above it. Here there is a +2 option available. So if you want to revise the cut, you can revise the cut by +2 by just changing your placement of the pin like this. So 2 pins here, and correction of you can take a +2 cut by using this jig. Now here the jig cut is made at 135-degree angle, that is based on the 135-degree cut. But if you want to increase the angle of your humerus, of your stem, there is an option of increasing the angle by increasing the base plate angle. So if you see the base plates, there are variety of base plates which are available. So you have a standard base plate, and then you have a 10-degree inclination base plate. Now this base plate will make your cut angle higher. So 135-degree angle, and this base plate, if you use over the top of it, you will have a 145-degree angulation, and you will be more close to the Gamow principle of a 155-degree angle cut. So this is a classical inlay. If you want to make, you can make it at a 10-degree offset sort of a base plate. So this is a base plate which you can use if you want to make a classical inlay. So this is the base plate if you want to do that. Now as far as the base plate is concerned, again there are variety of options which are available. We have a standard +3 and +6 base plates which are available for all the sizes 33, 36, 39. And these upper 3 base plates are for sizes 1 and 2. Whereas the lower base plates like here are for the sizes 3 and 4. Now this is for the whole system. Now we have another system, a deep dish. So these are the deep dishes which are available. So if you want to increase the diameter and use a deep dish poly, you have a deep dish option as well. So 0, +3, +6, and then you have a deep dish option also available for both the sizes. So it is available for +10 as well. So you have a variety of options available, variety of modularity which is available in the poly also. So lot of poly options also available with this system. So as we know that this is an inlay system, it's a very good system as far as the range of motion and the functionality of the shoulder goes. The fracture stem is yet to be awaited. It is awaiting a launch in India. But otherwise, for the most other patterns of diseases, this is a very good system and might go system as far as the reverse shoulder surgery is concerned. Thank you.